Good afternoon, everyone. I'm joining you today to provide an update on the return to in-person learning. I'm very happy to announce today that all students in kindergarten to grade 12 will return on May 25th to in-class learning as planned following the long weekend, with the exception of one area. The entire regional municipality of Wood Buffalo, which includes Fort McMurray. All those students in K-12 in this region will continue to learn at home for another week, with a targeted return to in-person learning on May 31st. The education system reset we announced earlier in May has been very successful. It has helped to alleviate the operational pressures tied to the rise of COVID-19 cases in our communities. However, it is prudent to extend at-home learning for schools in the region of the municipality of Wood Buffalo for another week to ensure that continuity of learning can continue. Case numbers in this community have not been trending downwards at the same levels as other regions, which means a higher likelihood of continued operational challenges in those schools. I recognize that while many parents and students in this region had hoped for a return to in-person learning following the long weekend, I am very hopeful that all students, parents, and staff in this area can soon benefit from a return to the classroom for the remainder of the school year. As a reminder, the decision to temporarily move to at-home learning province-wide was made by Alberta Education to help ease the operational pressures school divisions were facing due to the rising COVID cases across the province. At that time, we were seeing large numbers of school staff and students in isolation, which made continuing in-person learning very, very difficult. The decision to temporarily transition to at-home learning was a really hard one to make for me. However, it was necessary so that we could continue having our students learn and also have the ability to preserve the rest of the school year. To be clear, the decision announced on May 4th was not made by Dr. Hinshaw or Alberta Health. As students return to their classrooms, their safety and the safety of staff remain my #1 priority. As the Chief Medical Officer of Health has stated many times, the safety protocols that we have in our schools are effective. They are limiting the risk of widespread in-school transmission. The robust health protocols that have been in place in schools to keep our students and staff safe will continue, including mask requirements, cohorts, screening for symptoms, and seating arrangements. That is, in addition to the added layer of protection of more Albertans getting vaccinated, including teachers, school staff, and of course students that are ages 12 and older. Once again, I encourage every Albertan who is eligible to get their vaccine as soon as possible. The expansion of rapid test screening also within our schools is moving ahead as planned in Edmonton, Calgary, Grand Prairie, and Lethbridge starting next week, and in other communities where needed. I'm pleased to say that to date, close to 11,000 screening tests have been conducted in Edmonton and Calgary, and with only 44 preliminary positive results in our schools. Rapid screening tests are another tool we are using to keep our students and our staff safe. I understand it has been a challenging 2 weeks for students, parents, teachers, and other school staff across all divisions across this province. I know you had to adapt once again to learning at home during a school that has been like no other. I also recognize the difficulties that come with younger children learning at home from an academic, social, emotional, and of course from a family perspective. I sincerely appreciate all the efforts of everyone in our school system and in our school communities for your continued dedication to supporting students' learning during a global pandemic. I know it hasn't been easy, and I thank you so much for all that you're doing. I'm confident students will finish this challenging school year learning in their classrooms. I hope the return to in-person learning and the daily school routine will provide families with a much-needed sense of normalcy in their lives. And I know many of you are looking forward to enjoying your well-deserved summer break in about a month from now. Like all of you, I am hopeful for the speedy return to life as we used to know it and the end of this pandemic. Thank you, and I will now turn it over to Dr. Hinshaw to give her remarks.
Thank you, Minister, and good afternoon, everyone. Before I get to today's COVID-19 update, I would like to echo the comments that I made yesterday about school safety. As Minister LaGrange mentioned, the decision to resume in-person classes in most places in the province is an operational decision made by Alberta Education, and I am confident that we can all work together to keep cases falling in young Albertans. I know that in-person learning is critically important for many kids' educational and social development and can provide a sense of normalcy in these unusual times. I also know that many parents and others have anxiety about safety in schools. As a parent, I understand these concerns and the desire to keep our children safe. We have seen a sharp decline in cases in school-aged children in Alberta in the recent weeks. From an average of 60 new cases a day for every 100,000 children and youth in early May, we are now down to about 31 cases per 100,000. The data since in-person learning began has shown that cases in school-aged Albertans rise and fall in line with changes in rates of community transmission. Consider last January. When we went back to in-person learning, there were more than 2,000 active cases in Albertans aged 5 to 19. 6 weeks later, there were just over 700 active cases in this same age group. We saw that decline in active cases despite more than a month of in-person learning province-wide. Not coincidentally, this was a time when active cases were falling across our communities as well. When the third wave hit, the level of community transmission impacted all sectors of society, including schools. That is why it is more important now than ever that we continue driving cases downward and reducing community transmission. The numbers in our schools continue to depend upon the choices that each of us make every day to limit the spread of COVID-19 in our communities. This includes getting vaccinated and following all public health measures in place. As a part of continuing to reduce spread, extracurricular sports, recreational and performance activities for children and youth will remain closed in high transmission areas of the province for the next several weeks. I recognize that shifts between online and in-person school present challenges to students, staff, parents, and teachers. Thank you for adapting to these changes to help give Alberta students the opportunity to learn in person alongside their friends and classmates. Turning to today's update, we have now administered more than 2.27 million doses of COVID-19 vaccine. More than 50.5% of Albertans aged 12 and older have now been vaccinated. Over the last 24 hours, we have identified 908 new cases of COVID-19 and completed nearly 10,400 tests. Our positivity rate currently stands at about 9.1%. There are 685 people in hospital being treated for COVID-19, including 185 in the ICU. Sadly, I must announce that 6 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family and friends of all those who have passed away. Each death reminds us that we are not yet through this pandemic and that we all need to continue to follow the restrictions in place to bring our cases down. I have previously said that long-term, vaccines will allow us to ease restrictions in our continuing care sector. With vaccination numbers rising, I want to advise Albertans of changes we will be making to the operational and outbreak protocols of continuing care facilities. These changes take into account not only the positive impact vaccinations have had in these facilities, but also recognize the toll that COVID-19 has had on the physical and mental well-being of residents in these locations. As more Albertans become vaccinated, including at continuing care facilities where the vast majority of residents are fully vaccinated with 2 doses, we are able to safely ease some restrictions to increase the quality of life health, and well-being of residents. The most significant change we are making is a shift to a vaccination-based approach for assessing any additional precautions for new residents and residents returning to a facility from outings off-site. Effective May 31st, residents will no longer be required to be in quarantine upon admission to a facility or when they return from same-day or overnight outings. All residents will undergo a health assessment screening upon return to a facility. The precautions for residents who pass the screening will be based on the vaccination status of the individual. Fully vaccinated individuals require no additional precautions. Partially vaccinated and unvaccinated individuals will need to provide twice daily symptom checks for 14 days. Regardless of vaccination status, there are certain instances where residents may still need to quarantine, including if they don't pass the health screening upon return to the facility, and also if they've returned from international travel, being a close contact of confirmed cases of COVID-19, or if they have symptoms. Quarantine will also be required if a resident, regardless of vaccination status, returns from a unit within a healthcare facility that is on an outbreak. While there continues to be a small risk of exposure to and transmission of COVID-19, a number of safety precautions continue to be in place to ensure continued protection for residents and staff in these facilities. These safety measures include health screening before leaving the facility and upon returning, masking, physically distancing, hand hygiene, and symptom checking. These revised standards have been developed in consultation with stakeholders and after hearing feedback from over 2,500 Albertans in telephone town halls over the last few months. If you have a loved one in a continuing care facility, or if you're a resident in a continuing care facility and have questions about these changes, please contact the operators of the facility directly. And please be patient as each facility works with families and residents to implement this change by May 31st. This is a small step forward, but a reminder that we are making progress and that if we continue on this course, we will be able to safely get back to normal. So please be wise, stay safe, and get immunized as soon as possible. Thank you, and we're happy to take questions.
We will now move over to the phones for questions. Please indicate who your question is for. We will have time for one question and one follow-up. Operator, will you please put through the first caller?
First question is from Alessia Pasasume with Globe and Mail. Go ahead, Alessia.
Hi there. My question is directed at Dr. Hinshaw. How can you be confident that in-school transmission isn't a major problem?
We've been watching closely our numbers and trends, and it's important to remember that we have been very cautious when it comes to our approach to in-school precautions. So when an individual who has become infected is in a school while infectious, we identify the individuals within their class as close contacts. And so typically when an individual again has been identified as a case of COVID-19 and is on isolation, that exposure often does provide about, or lead to, I should say, about 30 people on average needing to be in quarantine. And so it's important to know that when we're looking at the impact of COVID-19 on schools, a lot of the impact is, again, when community transmission rises and we're seeing high rates in the community, there are many more of those exposures happening in schools. As we look closely at transmission patterns over the last year, we certainly see some occasions where there have been transmission incidents in school, but often what we're seeing is a pattern where there may be for example, students who were in class together but who also attended a social gathering outside of school. And we often see those social gatherings as the source of a significant amount of spread that then impacts school if people are in school while infectious. So again, we have not seen that schools, as we've been watching our case counts and our outbreaks, they have not been a significant driver of community spread. And instead have been impacted by community transmission with a subsequent significant impact, again, of many, many people needing to be out on quarantine to prevent in-school transmission. To be clear, that's the reason we need to take that cautious approach. But with community transmission numbers falling and with additional people every day getting vaccinated, the protocols that we've had in place plus the rapid screening approach, all of those things together, I believe, are making our schools as safe or safer than they have ever been.
Do you have a follow-up?
Yes. So what are your theories as to why cases in the 10 to 19 age group was the highest in the province during the third wave? So if not schools, where did these cases come from?
It's important to remember a few things that we've seen over the past year. One of those things is when in November and December, when we were watching cases rise in that particular school-aged age group, one of the things that we unfortunately needed to do was to pause extracurricular activities. And when we paused extracurricular activities, as well as restricting social gatherings and some of those other types of occasions where people would be getting in close contact with other people outside their household, all of those things were paused. We also had the junior, senior high students go to online learning for 2 weeks before Christmas, while our elementary age students stayed in school in person for that same length of time. One of the interesting things was that we saw the exact same drop in the COVID cases in junior, senior high age, as well as the elementary age in that same time frame, while one group was in school and the other was not. And so again, I think it's really important to remember that we continue to pause all of those extracurricular activities. We're continuing to restrict social gatherings, all of those types of activities where unfortunately transmission can happen quite easily, continue to be restricted so that we can keep schools as a safe place, as we saw that they were in that particular example in November, December. And again in January, we saw that with community transmission dropping, even having students go back into schools in person as the very first thing we did after Christmas did not change at all the rates of that particular school-aged group in terms of the COVID-19 transmission risks that we were seeing.
Operator, will you please put through the next caller?
Our next question is from Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hello. I believe my first question is for the minister. I'm curious what metrics we're looking at to make this decision. I know that it's been said a few times now that it's an operational decision to move students back in line, not a public health one. So what specific metrics, measures are we looking at to make this decision?
We're looking at the number of students and staff that are isolating. While we know that students and staff have been out of school learning at home for the last 2 weeks, we have still been tracking the number of students and staff that have tested positive with COVID, and therefore we can predict how many students and staff are isolating, and those numbers have decreased significantly. We had about 12% of our staff in isolation previously. We are now down to 2.2%. Again, operationally, we were struggling with having enough substitute teachers. There were some issues even with, at one point, bus drivers, et cetera. But now that we're seeing the community numbers come down, we're seeing the isolation numbers and the numbers of students and staff that are testing positive. Prior to the 2 weeks, we were over the 6,000 mark of students and staff that were positive cases. We are down to just over 1,000 right now. So taking all of those metrics into consideration, that is how we came to the decision.
Do you have a follow-up?
Yeah, this one's for Dr. Hinshaw. We've heard over the last few days now a number of times that we're going to move forward together collectively. But the latest restriction easing in long-term care homes, it's based around vaccination status, or at least part of it is. I guess could you describe why that decision was made to base it on vaccinations after we've been hearing that we're going to not use vaccination status to ease restrictions?
Sure, and it's certainly true that in terms of the general restrictions in the province, we will be looking at the overall vaccination coverage rather than individual status. The difference in continuing care facilities, and again, this is something that is part of how we manage, for example, every year with influenza outbreaks, we do look at vaccination status when we have an outbreak to manage it, to determine how we need to approach control measures. So it's a very specific and unique environment that's at very high risk of severe outcomes if the individuals who live there should become infected. We heard in the telephone town halls that we did over the past month or so that one of the most significant impacts people were noticing was the impact of a 14-day quarantine on people who perhaps moved from one location to another, or if someone, for example, was living in a lodge, owned a cabin and went to the cabin by themselves for the weekend and had to come back and be quarantined, that was having a very significant impact on their mental well-being, on their quality of life. And so in those very specific, very high-risk settings, we made the decision to utilize the impact of immunizations as a risk assessment metric. And so we are able to then help people who live there to improve their quality of life while at the same time requiring some additional measures such as those twice daily symptom checks to mitigate and minimize the risk of introduction of the virus into these high-risk locations.
Operator, will you please put through the next caller?
Next is Lauren Pullen with Global Calgary. Go ahead, Lauren.
Hi there. This first question is directed to the minister, but Dr. Hinshaw can chime in as well. One of the biggest concerns that we have heard from teachers and even from some parents is the yo-yoing that we have been seeing from in-person to online, again, to do with those isolations and those COVID exposures. What is your response to that concern with the numbers just starting to fall, but still very high here in Alberta?
Well, we've put a really robust plan in place. We've been able to address cases as they arise within our schools. School divisions and school authorities have the ability to isolate a classroom or a whole grade or a whole school with, of course, input from my department as well as Alberta Health. So we've worked very collaboratively. What we've really tried to do is minimize that yo-yoing. Unfortunately, at times it has been necessary, but we've been able to keep our schools open right through the whole school year. And I really want to reinforce what a positive move that has been to be able to keep our schools open. And we have approximately 25 school days left, some more, some less, depending on PD days. And I think it's so important for our students to be in school with their peers, with their teachers. They're so excited to finish off the year with the rest of their classmates.
Do you have a follow-up?
I do. This is directed at the minister as well, specifically about that robust plan that you've mentioned several times now. During the second wave several months ago, you mentioned a robust plan was going to be put in place. I confirmed with your office as of just a few weeks ago, before this latest round of moving to online, that no new province-wide protocols or safety measures have been put in place. And again, you mentioned the robust protocols off the top there, but didn't note anything above beyond what we've had in place throughout most of the school year for variants. What is the full robust plan? When will it be made public? And does it include any protocol changes or safety measures that we'll see when kids head back to the class on Monday?
Well, the robust plan has been in place right from the beginning. We made it public last year in roughly, I think it was around July. It had 3 scenarios. We went back in scenario 1. We had the option to switch to a scenario 2 or scenario 3 situation. We have increased the number of contact tracers. We were having an issue prior to the Christmas break, and following the Christmas break, the number of contact tracers, we have a dedicated group of contact tracers specifically for our schools. So that has certainly played into the ability to monitor those cases, as well as the fact that now we have rapid testing within our schools. So particularly in our hotspot areas, we've been able to increase the number of rapid tests so that we can identify asymptomatic individuals and get them out of the classroom sooner. Also, we've been very responsive to school divisions. We speak with them on a regular basis. I'm in contact with the education partners as well. So all of these, with the continued measures that we have in place, the masking, the cohorting, as Dr. Hinshaw has specified and I've specified over and over again, all of these work together to keep our students and our staff safe.
Operator, will you please put through the next caller?
Next is Jason Herring with the Calgary Herald. Go ahead, Jason.
Hi, this question's for Dr. Hinshaw. Our case numbers are going down certainly over the last week and more, but we're also seeing a decline in testing volumes, and the positivity rate hasn't actually dropped very significantly. I'm wondering why testing rates are down.
Sure, and we have been looking into this. Yesterday, I mentioned that some of the factors we think are a part of the variation in testing volumes are we've always seen on weekends, for example, we always have a reduction in testing volumes. They tend to go back up during the week. We know that as people are staying home more with the current restrictions in place, we're hearing from our local public health teams that sometimes people are saying, well, I'll stay home even if I feel a little sick. I'm not around anyone. I can safely isolate. And they may feel that they're not wanting to go out and be tested. And also, one of the things that actually just today we've been looking into is the impact that having students shift to online learning. We typically, again, as I mentioned earlier, when we have one case that's infectious while in a school, on average there are about 30 others who then would be deemed contacts and asked to go for testing. And so we've actually seen, in line with when schools went into online learning, some of the reduction in overall tests is a reduction in that age group. And interestingly, the positivity in that age group is relatively low because we see the risk in schools as less than other close contacts who have spent much more prolonged periods of time together with a case. And so those two things combined could be a part of the explanation why we've seen the reduction in testing volumes and maintained that high positivity rate. I note today, encouragingly, we are below 10% for the first time in quite a while. All of those things are early encouraging measures, though, so I want to reiterate that the best thing that all of us can do to make this return to school a safe one is continue to hold on to these public health measures, continue to drive down community transmission, to keep our schools safe and to give us the best possible chance of being able to lift the public health measures in the coming weeks.
Do you have a follow-up?
Yeah, for sure. Thanks for that. I guess the logical follow-up given that is that it was only a couple of weeks ago that, there was 5 or 6 day delays for testing in some parts of the province, including Calgary. So, I mean, is there worries that we could get back to these dramatic testing delays with the reintroduction of in-person learning?
We know that, again, testing is a function of many things, and Alberta Health Services worked very hard to increase their swabbing capacity and make sure that the lab had the capacity to process all those tests. So they are able to adjust to demand, and I don't believe that with the return of in-school learning, I don't believe that we will be seeing the 5-day delay that we encountered several weeks ago for various reasons, one of them being that, again, we are seeing our transmission, even our positivity rates slowly coming down. And the other factor, again, that determines how many people are getting sick, how many people are being exposed, is how many are out and in close contact with others. And we do still have all of the other public health measures in place that need to be followed. And all of those things also reduce transmission and therefore reduce close contacts. And by that, again, bring down the number of people who need to be tested who might have been exposed to COVID-19.
We have time for 2 more questions. Operator, will you please put through the next caller?
Next is Heidi Pearson with Global. Go ahead, please.
Hi, this question is for Dr. Hinshaw. Dr. Hinshaw, the Premier said earlier today that it would be about a month to 6 weeks before reopening happens, and that meetings about reopening will be happening next week following a long weekend. What kind of advice have you been giving to government officials about what is needed for that reopening to go ahead in that time frame, and what sort of factors might delay that 4 to 6 week timeline?
I was asked several weeks ago in one of my media availabilities if I thought it would be possible to have reopening this summer, to be able to have events like we used to have. And I said there were two factors to that. One is how high our transmission rates were, so how many cases we have and how those cases then are ending up in hospital and putting pressure on our acute care system. And the second factor is the proportion of Albertans who are protected with vaccine. And those two remain the most important factors. So if we are able to reduce our transmission of COVID-19 and thereby reduce the pressure on our acute care system. So if we're seeing our acute care numbers, our hospital and ICU numbers coming down, and if we're seeing our immunization rates rise to where we believe, again, that we would have that protection for the community, if we can achieve those two things together, and it is absolutely in our power to do so, then I believe that we will be able to have a summer with many fewer restrictions. And again, that's why I urge all Albertans to stick to the public health measures for the next few weeks robustly, step forward for immunization, protect yourself and those around you. And if we can do those two things, we will be able to have a better summer.
Do you have a follow-up?
I do, thank you. Pfizer, we learned today, can now be stored in a fridge for a way longer time. What does that mean for where it can be distributed and how that may change vaccine delivery and vaccine numbers here in Alberta?
It was very good news to see the stability data verified. As you may know, the Moderna product has been able to be stored at refrigeration temperatures for about 30 days for many months now, and that has made it easier to be able to provide that vaccine to, for example, rural areas. Now that Pfizer is also able to be stored at refrigeration temperatures for that same length of time, it will make it easier to provide that vaccine to other providers, such as physicians and pharmacists. So it's great news. And I will say, though, that we have been working very hard to overcome the logistical challenges that Pfizer has provided with the previous requirement, which was only 5 days at refrigeration temperature. And so now that we have that extra time, I think we'll be able to leverage the work that we've already done to have a good distribution system and create more opportunities to get both types of vaccine into places in rural Alberta where it may have been challenging to offer Pfizer before.
Operator, will you please put through the final caller?
Final question is from Kevin Nimick with CPV Calgary. Go ahead, Kevin.
Hi, Dr. Hinshaw. Throughout the pandemic, we've seen cases spike following long weekends. What makes you believe that that won't happen again?
It's a good question. We have made clear that there are no changes to the restrictions in place. So the May long weekend has no additional easings that are going to happen before that particular weekend. I would encourage Albertans to remember that how we work together to bring our cases down right now will have a direct bearing on how quickly we'll be able to ease our measures as we get towards the summer. So would really encourage all of us to remember the importance of sticking to the public health measures this coming weekend. In terms of whether or not we might see a spike, the other thing we've typically seen on long weekends is, again, we often see a reduction in testing volume, and on long weekends that can be a little bit more pronounced, with sometimes then a rise following that. That doesn't always translate. In fact, we wouldn't expect to see the impacts of transmission from the long weekend within a few days, but we can sometimes see a rise in numbers simply because of test-seeking behaviors. So it's important to remember that even if we do see that uptick, it wouldn't be related to those activities. But again, I really would want to say this is in our hands. Our future is in our hands. The more that we step up right now, the better our summer will be.
Do you have a follow-up?
Yeah, Dr. Hinshaw, you've described how sending students home to learn online has driven down caseloads, has lowered the wait times for testing, and has stabilized the teacher pool. If it's working, why are we diverting now?
It's important to remember that COVID-19 and the risks that it brings with it are one aspect of health risks. We know that kids are also directly impacted. Their immediate health as well as their long-term health is also directly impacted by their ability to access the educational and developmental opportunities that learning provides. And we know from the experience last year that the negative impacts of having kids not in person in school are differentially distributed. So kids who may already be struggling, again, this is kind of in the broad sense of determinants of health, are even more impacted by prolonged school closures than kids who may have been doing okay before that school closure. So it's really important from a public health standpoint as we're looking at the different kinds of policy options going forward as we're managing the pandemic, that we're looking at, first of all, certainly ensuring that we're not contributing to overwhelming spread of COVID-19, that we're protecting our hospitals, but also that we're mitigating the other impacts, that we're only using restrictions that are necessary and we're not using additional restrictions that also have negative consequences. So again, looking at that whole health of kids and the fact that overall community transmission is declining, looking at our very positive experience in January. Again, I believe it's important for the whole health of kids, which is good for all of society, that we support in-person learning with all of those things that have already been mentioned in terms of providing that safe environment in schools.
That concludes today's press conference. Thanks everyone for joining us.